Hi friends, Dr. Sarah here. Now, you've heard of the gut-brain connection. Have you heard of the thyroid-gut connection? It's pretty cool, intricate association, and I want to discuss it with you because a lot of people aren't aware of this so-called thyroid-gut axis. And it's pretty, well, even more than pretty. It's extremely important for optimal thyroid functioning. Your gut basically influences every system in your body if you weren't aware of this by now. And if you followed integrative health for some time, you've probably heard of the microbiome, right? So the microbiome is the genetic, if we're going to be technical, the genetics of all the different bugs that live in our gut and their communication with our cells and how that impacts cellular functioning. So this interaction. Well, those little bugs and our digestive health in general also impact thyroid and thyroid function and thyroid hormone levels. And what I want to do is take an article that I had the pleasure of writing for Rupa Health and go through with you the main key points about how the thyroid impacts the gut and the gut impacts the thyroid and why this is important for anyone struggling with balance in either. Now, if you want to get all the resources and references, I went into a lot of detail and there are a ton of references in the original article. There'll be a link in the video description. There'll also be additional resources on thyroid health using a naturopathic and functional medicine perspective that I wrote a while back. And specifically, there's another video too, in case you missed it. There's a link to a post on how to use essential oils and a naturopathic approach to assist with thyroid balance. Okay, so let's get started. First, I want to talk about how exactly the gut influences thyroid function. And it does this in several ways. First of all, those little intestinal bacteria down there in our gut are actually influencing our micronutrient absorption. They help to produce specific vitamins, vitamin K, folic acid, B vitamins. They help us break down dietary fibers and produce these short chain fatty acids, which regulate our immune function and do a lot of different cool anti-inflammatory signaling and other benefits. And then they regulate the immune response in general by their ratios. And they also impact the neurotransmitter signals to our brain. So there's a gut-brain axis, right? But all of these also influence the thyroid. We know that iodine, selenium, zinc, and iron are all needed for proper thyroid health. In order to utilize those nutrients and be able to have them optimize thyroid function, you need to be able to assimilate them in the gut. Then there's also the connection between the thyroid hormone levels in the gut directly. Specifically, what ends up happening is if we don't have optimal and healthy functioning intestines, we will have a problem with this iodine deiodinase enzyme. Okay, it ends in ASE. That's a clue that it's an enzyme. And that enzyme actually converts thyroxine, which is the T4 in your blood, to reverse T3, which is an inactive form. And we have to have a healthy balance of that along with the active form because you don't want your thyroid to go too high or too low. Another connection between the gut is the liver. There's some conversion of thyroid hormone in the liver, so we need a healthy liver. It also impacts bile function, which impacts TSH, which I'll get to a little bit later. And finally, this microbiota in our gut, as I said, it influences neurotransmitter signaling. Specifically for the thyroid, it's dopamine. And dopamine has been found to inhibit thyroid stimulating hormone. So if people are doing a lot of things to enhance dopamine, potentially it could impact their TSH levels. So those are some ideas of how our gut impacts our thyroid and our thyroid hormones. Now, if we look at the connection between GI health and thyroid health, and we can see that various disease processes, when these are not functioning well, are interconnected to the thyroid and the GI tract. So Hashimoto's thyroiditis and Graves' disease, those are the most common autoimmune thyroid disorders, and they often occur with autoimmune gut disorders, specifically celiac disease, and also an immune issue in the gut called non-celiac wheat sensitivity. And these two interconnections, again, are showing that there's an increased risk for someone with Hashimoto's to have celiac, and for someone with Graves also to potentially have an issue with gluten. In a small study with children, there was shown a connection of those with Hashimoto's thyroiditis and markers of intestinal permeability, or what is known as leaky gut. So there's another connection. Another association between the thyroid gut axis is that when those microbiota are invaded by pathogens, that's been found to have higher rates of thyroid disorders. Specifically, H. pylori or Helicobacter pylori infections have been linked to Hashimoto's, and Yersinia enterocolitica, as well as other bacterial organisms, have been associated with Graves' disease. Interestingly, people who have hypothyroid tend to have a slower digestive transit, and this can link to small intestinal bacterial overgrowth. And levothyroxine therapy has been shown in itself to increase bacteria overgrowth. There's been a link there. Mechanisms to be discovered. If someone could find that, I would love that. I have the study link. They've also shown a link between those who have had bariatric surgery and how that affects absorption of nutrients. This changes thyroid stimulating hormone, TSH, and T3 levels. So those are some of the connections between gut disorders and thyroid disorders and vice versa. Now, I talked about the important nutrients for thyroid function, and what I want to go through a little bit right now is why these nutrients are important and why they need to be absorbed optimally in the gut. So first, there's iodine. There's approximately 15 to 20 milligrams of iodine in the average adult, and most of it's in the thyroid, and it's essential for thyroid function. Too little can result in a goiter, it can result in thyroid nodules and even thyroid cancer, but excess levels are also an issue. It can cause a transient reduction in thyroid hormone synthesis, and too much iodine has been found to induce hypothyroidism, low thyroid function, in high-risk patients and those on diets high in goitrogens. Can say that. Okay, those are specific vegetables, but there are some caveats to that, as if someone has enough selenium and they are iodine deficient, it may not impact someone's thyroid as much as previously believed. So there's also the concern with too high intake of iodine, because that has been correlated with increased risk of papillary thyroid cancer. So it's really important to get the just right dose of iodine. And I've seen some backlashes with people who try to overdose on it and what it has done to their thyroid. So just be working with your doctor with that. There's also iron. 60% of those with hypothyroidism are diagnosed with iron deficiency, and it's likely related to this malabsorption. And you need iron also for proper iodine utilization and thyroid hormone synthesis. But because of the fact that iron supplements can increase iron in the colon, it can alter the microbiota in the colon and cause some adverse effects on the thyroid. So getting a good quality iron and also keeping inflammation down is important when you're supplementing with iron. Zinc is another cofactor for thyroid hormone production, and also for the enzyme 1,5-deionase that converts T4 to T3, its active hormone. And it also assists with oxidative stress as part of this enzyme pathway. It's also important for a hormone binding transcription factor. So it has several different roles in how it directly or indirectly impacts thyroid health. So we have iodine, we have iron, we have zinc, and then there's selenium, which regulates the immune system. And it's also involved in several thyroid functions. It's been shown to protect the thyroid from free radicals, and it's also been linked to microbial balance. Some studies even suggest that it could lower anti-thyroid antibodies. Those are a marker in your blood that goes up when someone has an autoimmune issue with their thyroid. There's caveats to that too, but I'm just giving you the basic overview here. And then with selenium, there's also vitamin D, which we hear a lot about. Now, vitamin D is also a hormone as well, not just a vitamin, and it has been shown to influence thyroid through its immunomodulatory effects. So human studies do find correlations between hypothyroid and TSH and T3 levels, and the fact that there's lower levels of vitamin D. So those are associated. Again, it's not necessarily causative, but they're linked, and it could be helpful to check your vitamin D if you have thyroid issues. Overall nutrient status and microbiome support basically are very important for the thyroid. And even Hashimoto's as well as Graves' disease patients commonly have been shown in studies to have altered microbiota, including some of the most seen microbiota that you get in supplements for probiotic, the lactobacilli and the bifidobacterium. It's been found these bacteria too also influence iron, selenium, and zinc, which are needed for the thyroid. So you'll see how these nutrients, which we need to absorb in order to optimize thyroid health, they're impacted by our gut. Now, how does the thyroid influence the digestive system? So what happens if your thyroid is off? Does it impact your gut? And the answer is probably yes, because it interacts with the gastrointestinal tract in several different ways. It can reduce motility, as is found in hypothyroidism, and it can increase motility in hyperthyroidism. So in hyperthyroidism, people could experience diarrhea and malabsorption, and constipation in hypothyroidism. Hypothyroid patients may also experience delayed emptying in their stomach, so it makes them feel uncomfortable and full, and they might result in trouble swallowing or heartburn, and this could be related to changes in the gastric mucosa related to an autoimmune issue or just an issue in the gastrointestinal tract. Impaired esophageal motility can also occur in both hyper and hypothyroidism. So there's actually receptor sites in the gastric mucosa and esophagus for thyroid, and it impacts motility. Thyroid disorders have also been associated with autoimmune gastritis and esophageal compression. So gastritis is inflammation of the gastric mucosa that is in your stomach, and then too much TSH decreases bile acids. So that's the synthesis in the liver, and bile acids are needed to regulate lipid, glucose, and metabolism. So again, that's impacting the metabolism in our digestive processes. So that's how the thyroid influences the digestive system. So let's take a deep breath. We've seen how the gut influences the thyroid through the bacteria, through its immune regulation of the bacteria, through the production of neurotransmitters with the bacteria, and the absorption of different nutrients that we went through, such as iodine, zinc, selenium, vitamin D, and iron. And then we just saw how the thyroid influences the digestive system. And there's also this connection that I briefly touched upon, and if you want to get into more details, you totally can in my article. But basically, autoimmune thyroid disease is believed to be the interaction of a genetic predisposition, immune impairment, and environmental factors. And the gut microbiota regulates the immune system, both the innate and the adaptive. There's two sides. And it's been said that about 70% of the entire immune system is situated in the gut, and it's related to these microbiota. So we want to keep them happy. And if not, if we are doing things that stress out our microbiota by not giving our bodies enough nutrition, by a lot of stress, by lifestyle factors, by environmental exposures, by different things that we're up against genetically, this can dysregulate our immune tolerance and could cause an autoimmune thyroid disease. And it's been shown the short chain fatty acid butyrate can actually help this T regulatory cells and may enhance immune balance and positively influence symptoms of those with autoimmune thyroid disease. We know the connection between celiac disease and non-celiac gluten sensitivity with different autoimmune thyroid diseases, and that there's this bacterial overgrowth, which can increase intestinal permeability, which is another factor that's believed to be related to autoimmunity. And this shifts pro-inflammatory cells into impacting nutrient absorption and immune regulation, affecting the thyroid, and could result in autoimmune thyroid disease. So basically, this bacterial overgrowth causes inflammation, this inflammation causes the intestine to get leaky, and it causes pro-inflammation all throughout your system, and it can impact your thyroid and your nutrient absorption. Now, there's different tests for thyroid health. Obviously, you want to get a full thyroid panel to evaluate your levels of thyroid hormones, such as TSH, T3, T4, free T3, free T4. So you have the bound hormone, the free hormone. You can check the reverse T3 hormone, which may be linked to an infectious process. There's controversy about exactly what reverse T3 is, but if you know that there's something in your body that's making reverse T3 higher, your doctor will want to investigate that. You can also do antibody testing for autoimmune thyroid disease, such as anti-thyroid peroxidase oxidase, and then anti-thyroglobulin. And doctors will know that Hashimoto's thyroiditis, the most common in the US, a lot of times has elevated TSH, low levels of free T4, and increased TPO antibodies. But that can change. So it's also important to look at the symptomology and also to note that antibodies can fluctuate during treatment. So just because they're going up doesn't necessarily mean you're doing the wrong thing. There's controversy about antibodies and thyroid disease as far as if it's even linked to mortality rate, or if it's really this, what we were taught in medical school, attack of the thyroid, or more just kind of an innocent bystander. So you can talk to your doctor about that. I've talked to my clients about that with their prescribing physician as well. There's different ways that you can order thyroid panels. I have them listed in my article. If there's doctors out there, if you want to ask your doctor about them, you can check them out from Rupa Health. There's also tests for gut health, and these are more functional tests where you can get a comprehensive stool test, and it tests for things like intestinal permeability, malabsorption markers, if you need additional digestive support, if there's an overgrowth of pathogens, if there's markers for gluten sensitivity, and all of these can be correlated to specific symptoms if you really want to dive deep into it and your doctor wants to get into this really well to see, the symptom picture isn't clear and they need more evidence. So I also have those highlighted by Rupa Health, what your doc can order. You can also get micronutrient testing. And the cool thing with some of these tests is that they actually look at the nutrients that get into the cell, not just into the bloodstream, so they know what you actively are absorbing. So how do you treat it? Well, first of all, you want to be able to share with an integrative doc or your doc a comprehensive health history and look for the underlying root cause. So that would be using a naturopathic or functional medicine approach. You can correlate this to the studies, the lab studies that you've gotten, and follow up from baseline what's going on with that as an objective measure as well, with the caveats keeping in mind that some of these tests, remember, are going to fluctuate even if someone's healing. And then you can look at supporting digestive health to support thyroid health if those are areas that appear weak or they're problem areas. So some things that could be helpful are digestive enzymes, bitters, which are herbs which stimulate gastric juices, which help with digestion and assimilation. Bile salts can be given, supporting intestinal integrity, remember, so that we can make that enzyme that helps with our thyroid hormone balance. Glutamine is good for the intestines. It feeds the intestinal cells. You can look at probiotics and prebiotics. So we want to feed the little bugs with prebiotics and fibers. And actually some of those probiotics, remember, those are linked to those correlations of if there's going to be a risk for autoimmunity as well as immune regulation and all of the different functions that those microbiota play as far as nutrient absorption for our thyroid. Saccharomyces boulardii is actually one of my all-time favorite supplements to give my clients. It helps support intestinal integrity. It can help with secretory IgA, which is a marker of intestinal health and immunity. It can help with microbial balance, and there's evidence for it treating diarrhea, so it could be helpful in hyperthyroid. There's grapefruit seed extract if there's any antibacterial, antifungal issues. Ginger is really great for digestive issues. Omega-3 fatty acids and resolvins can help with inflammation. And there's also essential oils. Two of my favorite for digestion are peppermint and ginger. There's a link in the article to my article in Townsend that goes through ad nauseum everything you want to know about essential oils and taking them internally for digestive health. Then, of course, a diet that incorporates organic, preferably, so you have less toxins in your system, right? So we know that toxins and environmental exposures can also impact the thyroid. So as much as you can, getting a clean diet. There's also the Clean 15 that you can find at Environmental Working Group. Now, I know that this is a socioeconomic issue, so you do the best you can, but overall, plant polyphenols can support gut health. They can help intestinal barrier function. They can help with your immune system, and they can help the balance of good bugs to bad bugs. So you want to get your fruits and veggies. You want to supplement with the nutrients you need. And remember, for specific ones, not too high or too low. So check with your doctor. You could be doing more harm than good if you are using these powerful micronutrients and not getting the right dose. You also want to check your vitamin D. Make sure if you take vitamin D, you also take magnesium and vitamin K with it, because those are important cofactors to make sure calcium is being absorbed properly. And then, of course, there's stress and lifestyle factors. Very important, mind-body connections for the gut, as well as the thyroid and hormone health. So there you have it. We've gone through a lot about the thyroid and the gut. I know this is a lot to cover. Now, I think you will agree with me that simply treating thyroid hormone levels with medication is probably not going to be enough to impact your thyroid long term, because there's all these interacting factors that may not be getting accounted for. Now, if you support the gut first and get all of those interfering factors out of the way, and then maybe proceed on to medication, or maybe you needed the medication first because it was so evident and the symptoms were so overwhelmed. But you can monitor now with also addressing the gut. And there's been some reports with clients and with patients that when they address the gut, their thyroid health really improves significantly. And they've monitored either weaning off thyroid medication or just adjusting the dose so there's less side effects and there's better efficiency. All right. So that is all. Please do make sure that you check out that article, because if you're, well, specifically if you are a doctor, you might want to check out those labs and those additional references. If you are just interested as a consumer to see what you can get and want to go more into detail than I even did in this video, check it out. And also to get those accesses to those links of additional articles I wrote, just overviews of thyroid health and how a naturopathic doctor will address that, because I talk a lot about mental health, but I also love women's health. I do a lot with hormones, especially menopause and perimenopause, and essential oils come into the piece here with thyroid and gut and all that stuff. So it's a combo of fun stuff for me. And I know a lot of people can benefit from this. So be sure to share this. Thanks for staying with me. I hope this was helpful, and please be sure to like the video and share it so that I can keep doing more of these for free for you, and we can get the word out there that there's more to thyroid health than just addressing medication, right? Although it's important for a lot of people, there's a lot more. All right, I will talk to you soon. Take good care of yourself, okay? See you later.